Welcome everyone, and thank you for joining us for today's webinar, Keynote Presentation, Cannabis for Mental Health, What Consumers Need to Know, presented by Jan Roberts, a licensed clinical social worker and CEO and Director of Translational Research at the International Research Center on Cannabis and Mental Health. My name is Susie Valdez, and I'll be your moderator for today's event. We're delighted to bring you this educational web seminar presented by LabRoots. LabRoots is the leading scientific social networking website and producer of educational virtual events and webinars. Before we begin, I want to remind everyone that this event is interactive. We encourage you to participate by submitting as many questions as you want during the presentation. Simply click on the Ask a Question box located on the far left of your screen and type those questions into the drop-down box. Our speaker will respond to your questions via email following the presentation. If you have any trouble seeing or hearing this presentation, please click on the Ask a Question box and let us know you're having a problem. This presentation is educational and thus offers continuing education credits. Please click on the Continuing Education Credits tab located on the top right corner of your presentation window and follow the process to obtain those credits. Now, without further ado, please join me in welcoming Jan Roberts. I will now turn the presentation over to her. Welcome, Jan.
Thank you. Thank you so much for having me. Hello, everyone. My name is Jan Roberts. I'm a licensed clinical social worker. I also own and operate Partners in Health and Wellbeing, a large mental health practice along the Mid-Atlantic. We see about 16,000 patients a year. I'm also the CEO and Director of Translational Research for the International Research Center on Cannabis and Mental Health. I teach at NYU, focusing on mental health and social work, and I'm really delighted to be here today. I got into cannabis and cannabis research really to help my patients understand more about what was happening and how cannabis could be useful for them in treating mental health conditions. And this is such an exciting field because for us, we know that there's a lot of misinformation out there. So today we're going to talk about what consumers need to know so that as a consumer, you can really have a better understanding about how cannabis can affect you from a mental health and wellness perspective. So today our learning objectives are really to identify the current deficits in knowledge and attitudes that mental health providers have, because as an educated consumer, you want to know exactly what's going on in the field and what potential struggles clinicians might be having related to cannabis and understanding it. Also, we're going to learn about how cannabis can positively impact patients and impact you. We're going to learn about the concerns around current cannabis research, as well as learning about the challenges that current patients have with cannabis treatment. This is a huge issue for us at IRC-CMH because for us, it is about the patients and it is about making sure that people have adequate, objective information to help them navigate this landscape of using cannabis for health. For me, it's important to see cannabis as a gateway to wellness. And I've come with this kind of thought around it just because cannabis is a gateway to wellness because it providing that its use is focused on the regulation of the endocannabinoid system. In mental health, historically, we've always looked at cannabis as a potential problematic use or a problematic maladaptive coping skill. And there is certainly a bias in the mental health community about looking at cannabis from a pathological lens. But for our purposes, and from the emerging research, is that when we really focus on cannabis as it relates to the endocannabinoid system, we can actually improve someone's mental health. So currently within mental health treatment, there are several challenges that affect us. And as a clinician myself, I have personally experienced this. You know, I was trained to look at cannabis use under the guise of substance use disorder, to look at it as pathology or cannabis use disorder. And many of my colleagues, we've all been trained kind of under that. And where that comes from is essentially back in the 70s with Nixon's administration and the war on drugs. NIDA was created, and NIDA was created essentially, that's the National Institute of Drug Abuse, was created to essentially focus on cannabis use from a problematic lens. In fact, one of its core components was really to identify how cannabis would negatively impact people. So all of the research that started to emerge were really focused on cannabis use as a pathological use rather than a health-related use or a preventative use. So the research has been focused on maladaptive use. We tend to focus on substance, not on the behavior that actually might be exacerbating that. We also know that patients currently use cannabis for the treatment of their mental health symptoms. In fact, other than pain, cannabis is mostly used for the treatment of anxiety and depression. And these are from national studies where people report why that they use cannabis. And so it's important, and I would have to argue that cannabis use really is more about therapeutic use rather than, I hate the term recreational use or adult use, because really, if people are using it to reduce their stress levels, if they're using it to kind of unwind at the end of the night, one would argue that that actually is kind of a therapeutic intervention there. There's also a lack of education around the endocannabinoid system as well as healthy cannabis use. And what happens with mental health treatment is that patients often don't talk about their use. They're afraid of being stigmatized. They're afraid of, if they're discuss it with their clinicians, that they're going to be labeled as a stoner or a pothead or someone with cannabis use disorder. So oftentimes, in my experience as a clinician, is that clients or patients didn't really feel comfortable talking about that. And that's a huge issue when it comes to mental health treatment. And there's also this large misperception about cannabis. Cannabis is not one drug. Cannabis is a compound. And we'll get into that further on. So last spring, I actually conducted a survey. Dr. Marcoux and I conducted a survey on mental health clinicians looking at their knowledge and attitudes around cannabis. And it was a pilot study. It was a small study. And the findings from the study really kind of were fascinating. And actually, we found some statistically significant data around this. There was a lack of agreement among the clinicians who were participants on the difference between healthy use and what abuse was with cannabis. In addition, most recommended cannabis for treatment of physical conditions rather than mental health conditions. And that kind of difference also kind of reveals the lack of knowledge about how cannabis can actually positively impact mental health outcomes. In addition, most of the clinicians surveyed were uneducated about the ECS, that's the endocannabinoid system, and how the impact on mood, how the ECS can actually impact mood. There was also a lot of confusion around cannabis's effect on future drug use. So, for example, there was an agreement about the gateway theory. Some clinicians reported that it wasn't really true, whereas a few actually said that, you know what, the gateway theory might be true. But the biggest concern was around the risk for psychosis or schizophrenia. And we even see that today in the research, where we get kind of competing and different kinds of data demonstrating whether or not cannabis has any kind of correlation with psychosis, you know, and that's a whole other issue that I'm fascinated by, because the studies, what we do know is that oftentimes people who are in prodromal stages of schizophrenia tend to self-medicate a lot. And that's usually, you know, so the question is there a causation or is there just a correlation between cannabis use and psychosis? Most, however, in the study that we did, this pilot study, knew really little about dosing. They knew little about the biphasic effect, which the biphasic effect is essentially that with cannabis, as in with many other drugs, you have to find the right dosage. Too little is not therapeutic. Too much actually causes problems. So very few of clinicians really understood that healthy cannabis use is really about finding what the right dosage is. Also, little information was known about how microdosing of cannabis could impact mood, as well as the chemical composition of cannabis and different cannabinoids and terpenoids and how they may impact mood, as well as receptors and stuff like that. And there was also little information about how people could be affected by different methods of consumption. And it was really fascinating to me that recommendations for cannabis, or clinicians who are more likely to be supportive of cannabis use with their patients, were actually, it was found mostly with clinicians who've had their own experience with cannabis use. Clinicians who did not have any experience with their own personal lives with cannabis use actually felt very, they actually were more afraid to recommend that. So one of the things out of this study is that we were awarded a grant through NYU to actually increase it with Dr. Lala Strassner, where we're going to be expanding the study internationally to look at other mental health clinicians throughout the world and seeing what knowledge they have around cannabis and cannabis use. And this is important, because if our providers really don't have adequate knowledge or have attitudes that are based in stigmatization that came from research, that they're less likely to create an environment where patients can talk about this. And they're less likely to really understand the nuances of mental health treatment that cannabis can provide for their clients. So I'm going to kind of shift a little bit and talk about the ECS. The ECS is the endocannabinoid system. And how does that exactly relate to mental health? Well, we know that the goal of the ECS is to maintain homeostasis. And that even includes emotional homeostasis. Homeostasis probably, I always have a hard time explaining what that means, but essentially homeostasis is a state of healthy functioning. And so the ECS's job is to help maintain healthy functioning within the body. We all have an endocannabinoid system. And it's fascinating because this ECS actually impacts emotional well-being. And we'll get into that in a second. So the goal of the ECS is to help, is responsible for eat, sleep, relaxing, and forgetting. And these are things that humans and other animals need to be able to kind of function in a healthy way. So for example, if someone's not sleeping, there's no way that they're going to be healthy. I've had patients who, because of lack of sleep, actually became psychotic. So it's important that our bodies have this ability to eat, sleep, relax, and forget. The ECS uses cannabinoid receptors that are located in the central nervous system, the peripheral nervous system, and immune systems. It identifies dysfunctions, it kind of remediates, and it restores to healthy functioning. So it's very important for all of us to have a healthy endocannabinoid system. But what does that have to do with mood regulation? So we know, again, that the ECS is really responsible for helping wellness by maintaining healthy functioning of cells, by maintaining healthy functioning of neurons, et cetera. So in the central nervous system, we know that the receptor CB1 is mostly found in the brain, even though it exists outside of the CNS, the central nervous system. We know that the CB2 receptor is primarily found outside the CNS, the central nervous system, and it's associated with the immune function. But it seems that the CB1, it's the most abundant receptor in the brain. So this is a cannabinoid receptor. And the really important piece about this is that this receptor, it's not found in the brainstem, and that's the area that controls respiration. And we'll kind of get, as we talk about opioids in a bit, we can kind of talk about that, the importance of that. It's also one of the reasons why, well, I'll go ahead and say it now, why, if someone utilizes cannabis, their respiration is not going to be affected. However, if someone is using an opioid and uses too much of that opioid, because of the receptors, it actually can shut down respiration. And that's usually what we see with a lot of overdoses from opioids. So how does ECS and cannabis potentially impact on mood regulation? So we've noticed that the ECS has been identified as a regulator of brain activity, hormonal function, and immune response. It links these three major regulatory systems together. And if it's functioning in a healthy way, it actually leads to healthy mood regulation. The ECS, and I love this quote from Hillard, it modulates virtually every brain region, and it thereby contributes to nearly every function of the central nervous system. And we know that with the ECS, that if it is responsible for healthy functioning, then what happens if there isn't healthy functioning? What happens if there's disease or illnesses? Ethan Russo in 2004, he coined the term clinical endocannabinoid deficiency syndrome. And the hypothesis is that, the well-regulated ECS leads to health, but the dysregulated endocannabinoid system actually leads to illness, such as inflammation, unhealthy neuronal functioning in the brain. And that emotional homeostasis is vital for mental health and healthy mental health functioning. Everything affects brain chemistry. Everything does. The music you listen to, the foods you eat, the friends you keep, everything can affect your brain chemistry. So the thought is if we want to have a healthy brain chemistry, we really need to have a healthy ECS. So this is viewed by some as the bridge between the body and the mind, connecting the physical reality with an emotional and an intellectual one. It's hypothesized that exogenous cannabinoids, like cannabis, which is a phytocannabinoid, that means it's a cannabinoid found within the plant, that you can actually use those to supplement the ECS, to bring about healthy ECS regulation. So this is where cannabis really fits into the mental health piece, is that cannabis can be viewed as a way to regulate the endocannabinoid system. So if we know that the ECS modulates the activity of a variety of neural pathways, including those pathways that affect avoidance and withdrawal, such as fear and the stress response, that we really need to be looking at the ECS. It helps tune the emotional and stress responses in humans and in animals. So if stress impacts the ECS, a dysregulated ECS will actually impact how we experience stress. So cannabis's impact in mood regulation can be vital here. We know, like I said earlier, that patients report that they use cannabis for depression, they use it for anxiety. We know that THC as a cannabinoid actually has antidepressant effects. CBD, although it makes you alert, it also has anxiolytic effects, and that's I guess a fancy way of saying it reduces anxiety. We are, however, unsure about the role of other cannabinoids and terpenoids. And right now, that, for me, is a really fascinating field to have better understanding about how CBG or CBN can actually impact that as well. And then what are the entourage effects of these molecular compounds actually working together related to mood? We know anandamide, the endogenous cannabinoid, has antidepressant effects. CB1 receptors in the prefrontal cortex and the vitreal hippocampus, that is, they're responsible for creating anxiolytic-like and antidepressant-like effects. So the activation of CB1 receptors in the ventromedial prefrontal cortex actually even leads to reduced startle reflex, and that's important for someone with PTSD. And what does that mean? That means that we have these potential applications for cannabis-based medicines. And this is a vital, very important kind of thing. Because if we look at how the ECS works, if we look at how these different cannabinoids can impact the brain, theoretically then we have an opportunity to use cannabis to help regulate one's mood. Right now, most of the research in mental health in cannabis has been based on animal-based models. You know, when they made the introduction, they said, I'm the director of translational medicine here at IRCCMH. And essentially, my job is to help create patient-focused research, help create research that we're actually looking at how patients or participants, humans essentially, are being impacted. So we know that there's very little experimental research on humans involving randomized control trials, and there are lots of reasons behind that. And that most of the research, like I mentioned earlier, has been focused on pathology, but it's also focused on cannabis. It really doesn't individually look at what the individual chemovars are and their impact on people. So again, remember I said that cannabis is not one drug. It's a compound that consists of many different chemovars that have potential impacts for mood regulation. So most of the research out there, you know, when I read a project or a research article and I'm reading about what they're talking about cannabis, I'm always asking, well, what was the chemical makeup of this? You know, what was the THC level? What was the CBD level? What was the CBN level? What were the terpenoids? And most of the studies out there really aren't looking at that. And that's really huge. It's like me saying that I am going to study antidepressants on people. Well, we know that there are different types of antidepressants that have different methods of action. So I can't really describe, you know, the effect of Zoloft like I would Wellbutrin because they're totally different types of antidepressants. So using that kind of analogy, we can't really say that when researchers are looking at cannabis, if we don't have a clear picture of the chemical compounds of that cannabis, we really can't extrapolate what the impact is on clients or on the participants. Another huge issue, and we've come up with this at IRCCMH a lot, is that oftentimes there's a lack of supply to do really good research. I'll give you a great example. In the state of Delaware, we were wanting to look at clinical efficacy of certain varieties on PTSD in veterans. Unfortunately, we couldn't guarantee that we could have enough supply of the same variety so that we could compare the exact same batch, the exact same chemical profile of the cannabis that we were studying throughout the entire length of the study. So lack of supply actually really does hinder our ability to perform great research on mental health. In addition, there are lack of standardized products. Because of prohibition, we can't ship products across state lines. So something that is grown in Massachusetts might, even though theoretically it should have the same chemical makeup, if it's grown in, say, Colorado, it might be a little bit different just because of how it's grown and other kind of issues. So prohibition actually negatively impacts our current research on mental health as well. And it's so difficult because of these nuances that people often don't understand that prohibition and every state's regulations really kind of keep us from performing high quality research or more research for that matter. But what does that mean to the consumer? Well, this is where I always really get concerned because I have had it where I've had consumers or patients of mine come in. They've heard something great in the news about a product or CBD, for example. And they come in fact, I had this happen once where a patient came in and she's like, look, I found this, I bought it at the store. What do you think? And we couldn't really look at the testing. There wasn't any information around the testing and what the testing had demonstrated. And so from my perspective, it was an unsafe product because I couldn't guarantee its safety. And this is just one of the many issues that patients face. Oftentimes there's lack of education about products. Even if a patient goes into a medical dispensary, they're having someone with no healthcare background giving them information about products. Oftentimes it can be intimidating to patients. Oftentimes what the bud tender, and I hate that word, but I'm going to use it there, or patient advocate, as they're called, what they provide is just kind of a very rudimentary, like, yeah, I hear this is good for that condition. I hear this is good for that, and so they really don't have a clear understanding about potential drug-drug interactions, stuff like that. So we have people who aren't educated on mental health, medical issues, providing patients with guidance around what cannabis products to use. And that's a huge issue. And it can be very confusing, the names of the varieties and what do they mean and what does it really work, etc. Another issue that patients face are supply-related issues, and that's a huge issue. I've had it where I've had clients who are using certain products that found them to be very helpful, only to, when they go back the next week to get the same product, it's not available. And they can't find out when it will be available. And these are really incredibly important issues that patients are facing. We would never say, okay, you're taking your beta blocker, this prescription, hopefully the pharmacist will have it next week for you. But in cannabis, we're seeing this all the time, where supply-related issues are actually impacting patient care. Another thing is that patients aren't really educated around what the biphasic effect is. And even though we always hear start slow, start a little bit and start it slow and let's see how it works, patients often don't understand that there's a reason that we're doing that. We want to find the optimal dose for that patient. And the reality is that everyone even metabolizes cannabis in a different way. Also, patients have very little information about the endocannabinoid system and what a dysregulated endocannabinoid system even is and how that could impact them. And then finally, it's that lack of safe, standardized products that I see as a clinician and here at this institute that we are constantly concerned with. We had, I know at IRCCMH, we've produced consumer warnings related to CBD products and encouraging people to actually use standardized safe products and knowing their sources, because if there is not a standardized safe product out there, and usually we find these in dispensaries, that could actually lead to negative outcome. So we had this consumer warning based on a Virginia Commonwealth study that came out recently, a few months ago. And essentially we told people, please don't use it unless you know where it's coming from and that there have been certain standards put into place and that they've been manufactured with safe practices. And one of the things the reason we did that was because the actual research on these products showed that there were actually counterfeit CBD products out there. It had not real CBD. It was a manufactured CBD, and oftentimes these oils would have additional components in them that could actually exacerbate mental health conditions. In fact, some of the chemicals that were found in these samples actually were found in K2 and in spice and would exacerbate anxiety. And so people who are taking CBD for anxiety all of a sudden might have an adverse reaction because of these other chemicals, and they don't realize it's really about the lack of standardized and safe products than it is about CBD. And people think that if I can buy it, it means it must be safe. That's not always the case. Unfortunately, it's not always the case. We get contacted constantly about this, whether it's through attorneys that are are involved in lawsuits related to unsafe products, or we've had it, through our own research, and we have a project that we're about to launch as well, looking at these kinds of products as well. So I talked to you a little bit about the patient advocate and the bud tenders kind of making these medical decisions, and that's a huge issue. One of the largest growing populations of cannabis users now are people older than 50. And, I love to go and sit in dispensaries and see, I love to people watch, I guess I'm a therapist, so of course I love to people watch. But it's fascinating to see how people become very confused about what they should be using, what they shouldn't be using. So we're lacking a lot of education with patient advocates. And again, any state, and I don't care which state it is, that allows medical decisions to be made by patient advocates instead of pharmacists or physicians, it's highly alarming. Another issue that patients face related to medical cannabis is access to care. There's a reality here that it's a very costly thing to get a medical cannabis card. Oftentimes, physicians won't sign off on it, or they've been instructed by the healthcare organization they work for not to sign off on medical cannabis applications. Unfortunately, I run into that a lot, where like probably some of the best healthcare systems in the country are actively telling their physicians that they're not allowed to sign off on medical cannabis applications for patients, regardless of the condition, because of the concern of liability and losing federal funding. It's a huge issue. And what happens is then patients have to go to another physician that they might not even know who they are, but that physician is going to be reviewing records and making that recommendation and helping them get their medical card. While I believe that this is a very important thing to have, it's a very costly, incredibly costly venture for patients. They can't bill with their insurance. They can't use their insurance to go through those companies. They have to pay out of pocket. Oftentimes it's hundreds and hundreds of dollars just to be able to get a physician to sign off on a medical card. And think about what that means. That means that a subset of our population can't afford to get into these programs. And say, even if they do get into these programs, insurance doesn't pay for cannabis. And oftentimes, because of the trial and error issue, because we're not really looking at how people metabolize different cannabinoids, people are having to try this variety, and that might not work. So then they're going to have to try another variety. It's not uncommon for patients that I've seen, for example, for them to have to spend hundreds of dollars just to be able to find a variety that works for them. And because of that, that's, again, we are limiting access to a medication because of these issues, so that you only have people who can afford this. I think that's one of the reasons we continually see the black market going, because it's almost easier just to stick with the black market than it is to jump through all of these hoops that are actually prohibiting people to get access to the care that they need. And of course, with the black market, you don't know what varieties you're using. You don't know if pesticides have been used. We don't know, if mold or any yeast or anything like that are in the supply. And so it goes back to the safe, standardized products are not available to people. In addition, we haven't really talked a lot about drug-drug interactions. Depending on the method of consumption, it really could impact how cannabis and other drugs are metabolized. And this is something that, as a research institute, we're really fascinated with, because we understand that you have to be able to look at what are drug-drug interactions. And patients don't really think about that. I'll give you, I'll talk about some cases in the future in a few moments, but I'll give you a great example. One of my clients, she was recommended to use by a bud tender a certain variety that made her incredibly anxious. Well, she was taking her Klonopin along with it. And she didn't understand that, no, you're not supposed to feel that way. And so we really have to pay attention to what these drug-drug interactions are. And we have to do a much better job about educating patients. One of the things I'm seeing in this that I'm actually kind of excited about is that now we have patients who are driving a lot of these changes. Not so much the physicians, because the physicians don't really understand a lot about cannabis, but it's the patients who are becoming much more educated around this. So what are some of the issues that providers face? We know that 9% of medical schools in the US teach about the endocannabinoid system. Only 9% of medical schools. That's amazing to me. So that means basically 81% of medical schools or medical students who are graduating to become physicians don't have a real understanding about the endocannabinoid system. And that's not even including psychologists, clinical social workers, counselors, nurses. It's not even including other healthcare professionals or pharmacists who really are seeing patients and interacting with patients on a daily basis. Most providers don't even understand that cannabis really is a compound. Unless they've gone through some special training, people tend to kind of, again, think of cannabis as one drug. Well, not all cannabis is the same. It's like the analogy I made with the antidepressants. Antidepressants are different because of their chemical makeup. So is cannabis. And oftentimes, as providers, we tend to attribute that people are wanting to use cannabis to get high, that there's a motivation for cannabis just to be stoned, rather than really seeing the therapeutic importance of that cannabis can play. And we really, this is such a nuanced field. And I always get nervous when I read research articles and there are these grand statements about, cannabis causes psychosis or whatever, that a lot of times, it's very nuanced. So what does the science say about cannabis? But also, what does it not say? We know, for example, with psychosis, that there is some kind of correlation. What that is, we don't know exactly what that is, but we do not see causation. So it's important for providers to really have the latest science. I can tell you, I teach about cannabis to mental health practitioners and physicians, and I always encourage people that once, or to students who are graduating to be these, and I always encourage people to stay on top. The research is so cutting edge right now that you need to continually read about cannabis to stay on top of what the science is saying. And also as providers, we need to be able to pay attention to what are the strengths of someone who uses cannabis and how can cannabis be used to enhance someone's life. For me, if I have a patient who is using cannabis and they're not engaging in their life, they're not feeling activated to join and enjoy their life, then it's really not a healthy thing for them. The last thing I want to do is to see someone who is going to escape their life with cannabis use, because cannabis can actually help activate and help people lead the best lives they can lead. And if it's doing the opposite, then it's not enhancing their life. And we want to stay away from that. So one of the things I also really like to teach with my patients is what is a dysregulated ECS and how can I pay attention? So if I'm using cannabis, I need to really pay attention to certain things to make sure that I'm not using too much, because according to the biphasic effect, I can even dysregulate my endocannabinoid system if I'm using too much of cannabis. So these are some potential signs of a dysregulated ECS. If you're highly sensitive to pain, if you have increased symptoms of anxiety or depression, if there's chronic inflammation, insomnia to the point of taking medication, having to take medication to go to sleep, bone loss, having chronic pain, dementia-like symptoms, a family history of cancer, or even a lack of motivation. These are potential signs of a dysregulated endocannabinoid system. So that could be that maybe you need to supplement with cannabis to help regulate it, or not use so much if you're using too much cannabis. These are some of the mental health issues impacted by cannabis: stress, depression, anxiety, PTSD, autism, anorexia, schizophrenia, sleep, sexual-related issues, and substance use disorders. Most people, like I said, use cannabis for depression and anxiety and pain relief. But when you hear people who are, and I come across the gamut of a whole variety of types of patients who use cannabis, that they feel that cannabis is a great stress reducer. It helps them unwind. It helps them kind of relax after a long day at the office. You know, for PTSD, I focus a lot on PTSD with my clients, and I'll get into that in a moment when I talk about a specific case, that the research is showing that there are definitely some, especially from the animal model research, some potentialities for cannabis for the treatment of PTSD. We know that it's also been helpful in sleep issues. We know for sexual related issues that about 2/3 of people who use cannabis actually report having enhanced sexuality and sexual experiences. In fact, I'm in a podcast with my colleague Jahan Marku and Greer Barnes and Randy Cameron, who are actors and comedians. And we actually, on our podcast, it's called New Hemp Times, we actually discussed this the other day. There was a recent research article that showed that cannabis, and this was with, I think, a university in St. Louis, where they had looked at females and their sexuality and found that cannabis was actually positively linked to female orgasms, that it actually positively impacted women who were having orgasms. It allowed them to have orgasms more. And so there's a lot of really exciting stuff coming up related to cannabis and how it can positively impact mental health issues. We also know, especially, and I know I'm talking about sexual related disorders here, but one of the reasons people get off of antidepressants is because of sexual side effects. So here we have this compound, this cannabis compound, that actually can enhance sexuality and maybe even provide relief from depressive symptoms. So these are some of the things that there are some potentialities here for cannabis-based medicines. I will say this. I think there is a tendency in this field to always think about cannabis as the perfect answer for everything. And it is not that. We really need to be smart about cannabis use, just like anything. You know, anything can become a disorder. It can be eating too much food. It can be shopping too much. It can be relationships. It can be a lot of different behaviors that present potential problems for us. But cannabis does have an abuse potential, as do many other substances and behaviors. And to me, this is a very powerful thing for us to acknowledge because, you know, this is empowerment. This is about teaching consumers that they're responsible for their bodies and they might want to make sure that they're living as healthfully as possible. So cannabis, as in many other things, does have an abuse potential. My rule of thumb is if you're using anything to escape your reality day in and day out, then that might be problematic, whether that's food, relationships, whatever. But we do know that there is an abuse potential there, and I work with my clients to make sure that they're using it in a therapeutic way. And I find that most people want to use it in a therapeutic way. And I have to say, there is nothing wrong with euphoria. There is nothing wrong with getting high, as long as you're still living that vital life that you should be living. You know, the gateway theory is something, especially in my field, that I was trained in. And the gateway theory has been debunked. You know, people tended to focus on cannabis as the gateway to other drugs, but they really weren't paying attention to coping and psychological issues that might have been actually exacerbating potential drug use. And that's vital. We have to look at how poor coping can create potential dependency issues anywhere. So like, for example, we see this for populations of obese people who've had gastric bypass surgery. They are at a higher rate of alcoholism as a result. And the reason is because you've removed their food source. They can't eat to the extent that they used to, but they can drink. So it's really about how do people cope with life rather than the substance per se. And we want to make sure that people have healthier coping skills. You know, there is nothing wrong with going home and unwinding with a glass of wine, going home and unwinding, with a joint. But are you living that vital life? And that's what we're shooting for. For me, I combine mindfulness-based awareness in my practices with my patients. I think it's important to ensure that my patients are paying attention to how cannabis affects them, just from the ECS perspective, but also, is this adding value to their life or creating harm? Because we want to be able to add value. And I use mindfulness-based awareness to really help people look at how they cope with life. But here's the cool part. Withdrawal from cannabis actually kind of mimics caffeine. We see some anxiety, nervousness, restlessness, irritability, and sleep difficulties, and it really doesn't last that long. It usually begins a couple of days afterwards. It peaks in a week. It can go up to 28 days, but it's usually that withdrawal is not as severe as other kinds of withdrawals. I know for me, one of the reasons I continue to drink caffeine is because, and I'm talking about caffeine, is because when I withdraw from caffeine, it's horrible. So I have to always have my coffee at least once a day. But cannabis use disorder, I think it's important for us to be able to understand that we can develop this if we don't pay attention, but we can develop maladaptive coping for many different things, not just cannabis as well. So how do we go forward from here? We really need to move towards more of a personalized medicine approach here. Pharmacogenomics is a really great field. I think this, from my perspective, is vital to know how do my patients actually metabolize cannabinoids. And I think we need to be able to move further in looking at cannabis chemovars, not just cannabis. Again, like I said earlier, cannabis is a compound. It's a compound of different chemovars that have different effects on the ECS and mood regulation. Another issue is that we have to have standardized products. This is necessary, not just for research, but for treatment. And then they need to be available to patients, because having a medicine available one week and not available the next is we should not tolerate that. It's inexcusable from my point of view. And that we really need to look at treatment formulations that should be based on chemovar composition. And we need to do more research on healthy use of cannabis. Healthy use can be defined as anything that makes your life better. And we don't look at that. Cannabis can be used positively for many things. It can make you feel more social. It can make you laugh more. It can bond people. It can have so many different positive effects that we have neglected to really kind of look at the positive impact that cannabis can use. And for a consumer, that's really important. And when you do talk to people who use cannabis, they often say, I just feel better. And it's such a subtle shift, It's, for me, cannabis, like I said earlier, is that gateway to wellness. Now, I kind of want to shift a little bit here at the end of my talk, because I want to talk about a couple of cases, because I think they highlight how cannabis can be effectively used, but they also highlight some of the major issues that we're seeing in this field and that every consumer needs to be aware of. So we know, this is my case, Michael. He is a 52-year-old man, Caucasian male. He has severe PTSD. He actually had he had found his wife after she had committed suicide and had been dead for many hours. And it was an incredibly traumatic event, as you could imagine. Michael had difficulties with sleep, flashbacks, constantly intrusive thoughts. He also had feelings of isolation. He was very depressed and anxious all the time and hypervigilant. Hypervigilant means kind of like overreactive to things. So we know from animal models that cannabis is vital for, or can be helpful for the treatment of PTSD. We know that mice who have been bred, for example, without the receptors in their brain, CB1 receptors, that they had difficulty actually forgetting and moving beyond harmful thoughts and memories. This is fascinating for me because this is exactly what happens with PTSD. When you have those recurrent flashbacks, those memories of these things that you've witnessed that are so troubling that it actually debilitates a person's functioning. And for this example, in Michael, he was feeling all of those kinds of things. But I know he has an endocannabinoid system. I know he has these receptors in his brain. And the idea is that if this works in a mouse study, ideally, we should be able to replicate this with human work. So Michael came to me very upset a couple years after his wife had passed and was seeking therapeutic help. He couldn't tolerate any antidepressant. He tried a couple of different antidepressants. He didn't like the way they made him feel. He felt detached from everything. Generally healthy guy, just really was struggling with his PTSD following his wife's suicide. And we know that the ECS is really linked to hypervigilance and negative emotionality. So we know that a dysregulated ECS actually would be exacerbating hypervigilance, would be demonstrating more negative emotions. And we know that the healthy ECS actually allows of extinction of aversive memories. Remember what I said about the mice being bred without the CB1 receptors? They were unable to forget that traumatic stimuli. And remember that the ECS's job is to help eat, sleep, forget, and rest. We need to forget certain things. And flashbacks is that inability to forget that horrible trauma you've experienced. So Michael came to me. He couldn't tolerate the antidepressants. He was severely depressed. As a clinician, I was highly concerned for him. And he and I were talking, and he decided that he wanted to try cannabis. Well, I encouraged him to go through the state's program. You know, he had a medical qualifying condition, PTSD, that would allow him to get accepted into the program. And he was very kind of resistant about that. So he started getting cannabis from his neighbor's son. I would ask him, well, what are you using? He couldn't tell me. He was kind of all over the map with how he was feeling. But finally, you know, after my strong suggestion, we got him through the medical cannabis program in the state where he lives and had him start to go to dispensary. And we found that during the daytime, high CBD flower, you know, that actually helped him. It motivated him. He felt better. He started golfing with friends, started to interact more. And at night, he was using a variety that actually helped him sleep a lot better, that he felt more rested. And the flashbacks started going away. And the flashbacks just not having those intrusive thoughts constantly helped him feel better. His depression started to lift. Now, I'm not saying he became healthy. I'm not saying that he was cured. What I am saying is that the symptoms that he was experiencing actually allowed me to do therapy more with him. It reduced his symptomology, and he was able to engage in life again. But here's the kicker. They quit carrying the products, a couple of the products he was using. So he had a struggle of, well, what do I do? I can't get it. He would go every week hoping that they would have the product that helped him sleep at night, and he couldn't get it. So that lack of regulated supply really negatively started to impact him again. He started to have difficulties with sleep. But once he was using the cannabis again, he was able to sleep better. So it demonstrates that cannabis actually helped remove some of his PTSD symptoms, or reduced some of his PTSD symptoms, and that he started to gain more acceptance. And that's a huge thing for PTSD. He started to gain more acceptance about where he was, and he's doing much better today, and cannabis has been a great therapeutic tool for him in his recovery from PTSD. The last case I want to talk to you about is Kim. Kim has anorexia. She is a 55-year-old woman who had struggled with anorexia since her early teens, had been hospitalized 21 times. Now, anorexia typically is not allowed on any U.S. medical qualifying conditions list. However, it often coincides with PTSD. So fortunately, she was able to get in the state's program because she had PTSD as well. We know that cannabis has a demonstrated positive relief from wasting syndrome. You know, this is one of the reasons why people undergoing chemotherapy are always, encouraged to utilize cannabis. It helps them eat. It helps them gain weight. And I had the pleasure of meeting a researcher in Israel this past fall who had done the study on THC that actually also demonstrated that THC positively impacted weight gain for anorexic patients. So Kim started using cannabis. She went to a bud tender. This person gave Kim advice, and the issue was, this was the one I had mentioned earlier, where she actually was taking her Klonopin because the cannabis was making her too anxious. And so when she came to me and we started talking about it, I'm like, wait. Let's look at the varieties that are available, because obviously you are using something that's not helpful for you. And this is, again, where I think our system is flawed here. So we were able to find a cannabis variety that helped her. She got off of her benzos, which is a huge issue, benzodiazepine usage. And we're really hopeful that we can use cannabis in replacement of benzos. And she was able to do that. And the irony is she gained weight. Now, this is a woman who's been hospitalized 21 times. And having worked with people with trauma and eating disorders and personality disorders over the year, I can tell you this, that even if my patients gain weight, they do not like that they gain weight. They're angry that they gain weight. They might gain weight just to get the physicians and everyone off their back and to avoid hospitalization, but that does not mean that they like themselves at that weight or accept themselves at that weight. This was what was fascinating to me, though. Kim was okay. She was like, yeah, I'm gaining weight, but I feel better. So here is a woman who had been hospitalized so many times, who had struggled with this condition for almost 40 years, for 30-something years, and she was able to gain weight. She was even able to do some other transitions in her life that she felt better about. She was engaging with her family, whereas she had not really been doing that for a lot. And she got better. And she's been out of the hospital for years. She hasn't been to the hospital since she started cannabis. And these are the kinds of issues that are so important. So the issue here was that, as a consumer, Kim had no idea that she wasn't supposed to be using a variety that might exacerbate her anxiety or take her Klonopin in addition to it. She didn't know about the drug-drug interaction. She didn't know that, there were different varieties that would actually affect her differently. I spent a lot of time talking to her about the endocannabinoid system. And it's fascinating, especially with anorexia. That's one of my areas of interest, and she got better. So as we get into cannabis and its impact on mental health, we see some positive changes. We have to go beyond case studies, though, to really look at how the components of cannabis, the chemovars within cannabis, actually do impact mood and mood regulation. And like I said earlier, we know that reason is because of the endocannabinoid system. So I know I've shared with you lots of information. I'm sure you probably have questions. Send me your questions. I'll be happy to respond. But I really think that we have this opportunity to change the way we think about cannabis with mental health. Thank you so much for your time, and I hope you enjoyed this.
Thank you so much, Jan, for that informative presentation. I'd also like to thank LabRoots for making today's educational webcast possible. As a final reminder, Jan will follow up with any questions you've submitted via email. That's all for now, and thanks for joining us. We'll see you next time. Bye-bye.
Bye-bye.